Okay, so you are the happiest group of people at 6:45 a.m. that I have ever been around. So the other thing I'm going to say is this is like church where everybody migrates to the back, right? That happens all the time. And then why are we the ones that are not on spring break this week? Is that why you invited me, Sue? That the crowd will be smaller and it will all be good. So. It's been several years actually since I've been here to visit with all of you, and I'm honored to be back today. As Alana said, I have the privilege of serving as the president of Carle BroMenn Medical Center, Carle Eureka Hospital, and I lead our service area, the medical group, and our region as a part of Carle Health. I've been here for 11 years. And I moved here about 10 months after BroMenn had become was acquired by Advocate at the time. I moved here from Chicago, although I was not with Advocate. And so it's just this is home for us. I am married to my husband for, I think it's 27, 28 years, you'll lose track. Proud parents, 2 children, a 23-year-old and a 17-year-old daughter who's a junior in high school. Who's more interested in finding a prom dress than studying for her ACT. Can anybody relate? I'm like, oh, really? So I thought I would take a few minutes and just share with you, provide a little update about what's going on at Carle. But the first thing I want to say, because I've spent the last 2 years, I think we all have talking about COVID. On a positive note, I think we're all seeing the same things, that the numbers are continuing to go down, and we're very hopeful that it's really going to become, or is becoming, more of an endemic rather than a pandemic, something that we're going to live with. We're going to see spikes, but hopefully not to the extent that we've experienced thus far. Across our Carle system, and I'll talk a little bit about that, at the height actually, which was about 6, 7, 8 weeks ago, the last surge that we saw with Omicron was more significant than anything we've experienced in the last 2 years in terms of hospitalizations. We had about 220, 30 patients in-house. We are now, across our system, we are now down to less than 15, which is absolutely fantastic. I think at BroMenn yesterday we had 3, at Eureka we had 1. So really positive. So I think a bit of good news considering where we've been the last couple of years. So when I think back, we had the privilege in July of 2020, in the middle of a pandemic, of joining Carle. As I said, we were a part of the Advocate healthcare system for 10 years prior, which was fantastic. Advocate invested very heavily in this market, and we've grown through the time we were a part of Advocate. Prior, though, about 3 years prior to 2020, we started doing some clinical work with the Carle Health System, with some of their maternal fetal medicine team, with their level 1 trauma, with some of their trauma surgeons at the cancer center. So we had started developing this natural relationship working with the Carle system over in Champaign-Urbana. That then turned into the opportunity to join and to become a part of Carle Health, which happened in July of 2020 in the midst of a pandemic, when we could not be together and actually meet one another. So we still, believe it or not, are having teams of our physicians coming together to get to meet each other face to face, not just on Zoom, which we're so happy about. But a little bit of background, just maybe about Carle. So Carle Health is, now we are a 5-hospital system, and we're vertically integrated. And you're probably saying, what do you mean by vertically integrated in the healthcare world? So when we talk about vertically integrated, we think of a system that has the hospitals, we have the medical group, so our physician complement, and we also have the health insurance arm, which for us is Health Alliance. Doesn't mean we partner with all health insurances and we accept all, but Health Alliance is a part of Carle Health. So that actually, when you think of diversification of your own portfolio, and I'm just going to comment on that because the buffer, so Health Alliance, actually the health insurance arm operates in 6 states, including the state of Washington and the state of North Carolina. Now, Pinehurst, if any of you are golfers and have played Pinehurst number 2, there is First Carolina Care that is part of Health Alliance. So the interesting part of when you think about the full continuum we have the opportunity to really focus on maximizing value for not only our patients, but also for those that we contract with as we look at even direct contracts. So I won't bore you with all of that, but that is really a unique aspect of being a part of Carle. So we have 5 hospitals. We've got our 5 hospitals, Carle Foundation Hospital, which is the level 1 trauma center. We've got BroMenn, we've got Eureka, we've got a hospital in Hoopeston and down in Olney. We've got over 12,000 employees or team members. And you might have read that most recently we've signed a letter of intent to have the 3 hospitals that are a part of the Unity Point Methodist in Peoria join and become a part of Carle Health. So if you're familiar with Methodist Proctor Pekin hospitals, along with their physician group, and the Methodist College, which is a small liberal arts college, I always thought it was just a college of nursing, but we are moving forward with plans for that part of the Unity Point system to break away from Unity Point and to join Carle. So we would become an 8 hospital system and grow. And then when you look at kind of the opportunity we have then from a service standpoint, it's very exciting. Over the past 18 months, and I want to just really brag on Carle and being a part of such an innovative system. So over the past 18 months, in the midst of a pandemic, with everything going on, the amount of work and investment that Carle has made in our service area is remarkable. And I just want to share with you strategically some of the noteworthy accomplishments. So you might recall back, it was a year ago, October, it'll be 2 years this October, year and a half ago, the Community Cancer Center here in town became the Carle Cancer Institute of Normal, wholly owned as a part of Carle. So that whole building and all of the organization within that and the cancer services are now a part of our Carle family. What became really unique in that opportunity, and I'm going to brag on Jenna Hart, give a wave there, Jenna. Sue introduced you. Jenna is our manager of business development and does just yeoman's work in terms of strategic planning. I always say, build the plan, work the plan, right? That's what in our lives we do. So we built out with physician support an amazing multi-year roadmap for cancer services for our service area in our region. So one of the first things that we implemented as a part of that strategic plan was a multidisciplinary same-day breast clinic. And you might be thinking to yourself, Colleen, that whatever you're saying doesn't sound too interesting. Well, this is now state-of-the-art care that we are providing. So a newly diagnosed patient, and I'm going to say woman because more are women than men, when they're diagnosed, they now have the opportunity at the Cancer Institute to see on the same day the medical oncologist, the radiation oncologist, and the breast cancer surgeon in the same day, the physicians come to them. And so this visit used to take, and to be coordinated, making your own phone calls, it used to take 2 to 4 to 5 weeks to try to get yourself in to see each of those disciplines. What happens now is, and I'll give you a story, but they see those 3 disciplines, one appointment, either a Wednesday or Thursday, it's every week. And on Friday of that week, that patient's case and those physicians present it to a multidisciplinary tumor board, a breast tumor board group of physicians that includes not only those providers of those disciplines, but it includes the radiologist, the pathologist, and other physicians that also practice as a part of that cancer team. They review the findings from that individual's pathology staging, everything that's been done. And when they walk out that Friday, that multidisciplinary plan of care is established and is communicated and actually begins immediately. And so it's actually, when you think of it, state of the art, this is what should be done, and it is now being done. And Dr. Stephen Pilcher, if any of you know him, was sharing a story that he had one of his patients a couple months ago that was newly diagnosed, maybe saw her, it got her in the next week to the multidisciplinary breast clinic. That patient saw everybody, and that following, about a week later, had the entire plan of care ready to begin in terms of her breast cancer treatment. And the words he used were dizzyingly fast, right? And time matters when it comes to a cancer diagnosis. So we're excited about the state-of-the-art care. That's one example. As a part of that cancer team, we've hired Dr. Maddie Francois. Many of you might be familiar with her. She is dedicated now at the Cancer Institute to only doing breast surgery as a part of that cancer team. So we're excited about her addition to our cancer family. In addition to what I just talked about with breast cancer, we have just started the same multidisciplinary with colorectal cancer with Dr. Daryl Fernandez. So the same thing, medical oncology, radiation oncology, and colorectal surgeon on the same day, then going to the multidisciplinary colorectal tumor board. And then the final tumor board that we just instituted multidisciplinary last week was for lung cancer. So if any of you know, like Dr. Dave Coe, John Burr, some of our pulmonologists are very excited and have been passionate leading the way for this. They anticipated last week that as they kicked it off, they hoped they'd have 3 or 4 cases, and they had 9 cases to review in their first multidisciplinary lung tumor board meeting. So the need is there, and we're excited. At the end of the day, we are here to serve the community, and one of the philosophies that you will always hear me say is that what can safely stay in our community and what services and care we can provide, we should provide. For care that we can't safely provide, we should have a seamless continuum and a partner to make sure that we are able to facilitate that for the best care possible. But look for us to continue to grow and to invest in this community and to be able to elevate what we can provide locally. So a couple of other areas that I just want to highlight for you that have really been wins over the course of the last 18 months is we brought on board and had the local neurosurgery group. Many of you might know Dr. Ann Stroink, Dr. Jason Seidley, and Emilio Nardoni. Those 3 neurosurgeons joined our Carle family last June, and they've moved on to our campus. Their office is now located on the BroMenn campus, and just finished another strategic planning process for neurosciences service line. And along, part of that, and this really kind of highlights the investment that Carle has made. So not only have we brought them on board, and you think about the opportunity to grow from a neuroscience perspective, we have a $12 million project underway. It's a 4-phase project for renovation and upgrade of our cardiac cath lab, which also includes a new biplane neurointerventional. I'm sure that doesn't mean much to you, but if you come in with an acute stroke and you have a blood clot that is in your brain, Dr. Ajit Gordon can go in through your groin and go up into your brain and remove that clot. And that's part of the whole neurosciences plan. And it's, again, we are upgrading and building state-of-the-art not only for our cardiac program, but also for our neurointerventional. And what I would say to you is we often take for granted the level of care that we provide in this community. It is astonishing because many communities would absolutely die to have the caliber, the quality, and the skill set of the physicians and the technology that we possess here in Bloomington Normal. And that's our commitment to you to continue to upgrade that. Couple of others that I just want to highlight. On the orthopedic front, McLean County Orthopedics, which is now a 10-physician group. McLean County Orthopedics joined and became a part of our Carle team in August of this last year. And so now they're Carle McLean County Orthopedics, if you've seen some of the advertising. But the neat part about that is also, I loved the advertisement for, where'd you go there, Chris? I love the advertisement on there. I didn't know what you were doing for the Carle Health and Fitness Center, but attached to the Carle Health and Fitness Center is the McLean County Orthopedic Practice, which is Carle McLean County Orthopedics now. And we have the opportunity now and this strategic planning process is just going to be kicking off to really look at the enhanced collaboration and growth. We've embedded two sports medicine, family medicine sports fellowship trained physicians also now in that practice. So along with general orthopedics, hand, many of you know Dr. Oki, pain management services, Dr. Nauer and Dr. Michaels, and we now have not only podiatry, but the two family medicine sports physicians as well. Dr. Novotny has started going out to Eureka and is actually doing joint surgery at Eureka Hospital. First time that orthopedics have been done in over 15 years out in that community. So excited about that. And the last area that I want to just highlight for you, and again, this speaks to the investment that Carle is making in our community and in our service area. We have recruited, notwithstanding what I just talked about, so not including those physicians, we have recruited over 30 new physicians in the last 18 months to this community. So, and when I highlight for you some of the areas, these are very hard to recruit. So we've hired infectious disease, which we have not had infectious disease services in this community for about the last 4 or 5 years. So we've got infectious disease. Dr. Ashley Siniceros is now able to provide both inpatient and outpatient care from an infectious disease standpoint. Endocrinology, we've recruited another endocrinologist to the market, Dr. Doss. A new neurologist, Dr. Daniel Young, right across the street, is joining Dr. Herman Dick, Dr. Fong Lee, and Dr. Kurt Hayden. Dr. Young started about 6 weeks ago, so excited about him joining. We just hired a new pediatric adolescent psychiatrist. Dr. Burgundy Johnson is going to be starting with us next month. She will be doing all virtual, but quite frankly, one, she's able to supervise other APPs, advanced practice professionals, that are able to treat patients and quite frankly, in the pediatric adolescent psychiatry world, which they are so hard to come by right now, most youth are actually more comfortable with virtual visits because they live on their phones with technology than they are actually face-to-face. So we're very excited, and we've got an offer out for another 0.5 on the pediatric. So our commitment to mental health, behavioral health services remains very strong. And then I want to just highlight several new primary care physicians that have also joined and moved to our community. In both on our Bloomington campus, out at Seabach, and our Normal campus. The one on our Normal campus, Dr. Maria Saavedra, is bilingual and is also Spanish speaking, which has been just fantastic. We've got Dr. Ali, who is out on college in Towanda. Dr. Ifam is out at Seabach. And we've also recruited for 2 new primary cares at our Eureka Hospital practice, another one in Fairbury, another one in Roanoke, and another one in El Paso. So what I want to leave you with is the fact that there is so much good going on in our community when I think of all of the special aspects of living and working here in Bloomington. And we are in the midst of our 125th year and celebrating 125 years of our heritage at the hospital. And it's an honor and a privilege to be in a position where we continue to invest in the long-term growth and the long-term health and well-being. It's funny that when businesses are looking at even from an economic development standpoint, right? Looking at relocating, we are an important part of the economic package that businesses and that families, so as you recruit individuals into the community, we're an important part of that. They're always asking, what are the schools like? What is the community like? Is it safe? What is healthcare like? And so we want to do our part to make sure as we continue to grow and elevate and be strong in Bloomington Normal, that we are a key part and we are your partner in doing that. So thank you for the opportunity to be with you today and to share a little bit One, it's great to be face to face and to see all the smiling faces. But again, I just so appreciate your service and all the commitment that you make being a part of Rotary. And again, thanks for the opportunity to be with you this morning.
Our community is blessed in many ways, and one of those ways is two really good hospital systems.
Yes.
Could you speak to maybe competition as well as cooperation between Carle and OSM?
Sure. So I echo that, and I have always said from day one moving here that our community is very blessed to have two very strong hospitals. So we collaborate in a number of ways. Used to be through the Community Cancer Center, which is no longer the case. What I would say is, the ways of collaboration, even in terms of I'm trying to think of the right words, right? Even probably more so even at the staff level rather than at the administrative level. We partnered very closely during COVID, and we were on system calls together working with the health department, trying to coordinate all kinds of things related to EMS, related to vaccines, related to infection prevention protocols. And really, there's oftentimes we do better when we coordinate, like, where are you going in terms of how are you handling from a visitor standpoint? What are you opening up? What are you not? Those kinds of things, because we do better oftentimes when we have one standard across the community. And the other part is, so we don't plan strategically together, right? We've always been very collaborative, but I think the neat part is where there is really great collaboration is at the staff level. So when they need medication to go back and forth, if an MRI goes down at one hospital, the other hospital will send patients over, and we'll have a collaborative relationship to make sure that we're seamlessly caring for one another's patients. So there's many ways, that we collaborate, probably more behind the scenes, things that you don't think about or that we wouldn't talk about strategically. We share supplies. They'll share medications if one is short for one reason. So the commitment that we've always lived by is the patients come first, and we will always collaborate to do what is in the very best interest of the patients that we are serving. Great question. Any other questions? All right, thank you.